morning, everyone. Mwazuka bwanji. Welcome to our finale talk on our series Wildlife Handling and Healthy Care, Capture, Treatment, and Disease Management. Last week, we looked at reptiles, and if you missed it, just be on the lookout. It will be on our website very soon. Today, we're going to dive into the world of carnivores. We're going to look on management and healthy care of carnivores. By the end of this talk today, you should be able to, 1, understand why wild carnivores are like lion are captured. 2, learn effective capture and immobilization techniques for large carnivores. 3, know the key drug protocols and how to monitor animals during anesthesia. 4, identify and manage common diseases in wild and captive carnivores. 5, which is the last one, explore capture, care, and innovations in wildlife veterinary medicine. And today we are very, very lucky because we have 4 speakers from 3 African countries. From my left, we have Dr. King Chidakwa from Zambia, be talking on wild dogs. And second, from Dr. King, we have Tarin Chana, who will give us a virtual tour and will show us all the carnivores. Then on the middle, we have Dr. Brendan from South Africa, who will talk about immobilization of the large carnivores. And to my right, we have Dr. Mukami Ruoro from Kenya, all the way from Kenya. She will talk about lions. Yeah. So for the start, I'll introduce them separately, but we're going to start with Dr. King Chidakwa. Dr. King is a wildlife medicine vet who just after graduating chose to be in the bush, and is someone who is very comfortable when it comes to mobilizing wild dogs. And he's someone who outsmarts hyenas and also puts collars on the carnivores. Today, he's going to tell us how do we handle wild dogs? How do we immobilize them? Thank you so much. Dr. King, the stage is yours.
All right, thank you so much for that introduction, Sela, and thank you so much to the management for organizing such a beautiful, to share our possible experiences in wildlife. Yeah, of course, it's a great privilege, to be given. I really love to share my experience in most occasions. So equally here in Zambia, I do meet a few students here and there just to share my experience. Yes. So just take you through actually. I've already been introduced. I equally do work for an organization, Panthera. Yeah, so I'm the veterinarian, the other veterinarian here in Zambia, who is responsible for all the carnivore, vet-related works. Yeah, so basically we are a conservation organization. Yeah, so thank you so much. I think I will be talking about wild dogs, and throughout my talk, I think the outline of how my discussion will be, I think I'll start with just a small introduction. Thereafter, we'll look at some of the conditions that we may likely to encounter in the field. Of course, not all, but I think we'll handle quite a few that are much more common. Therefore, we'll look at how they present and then the management protocols that we may probably utilize. Okay, from there, we're going to quickly run through the immobilization of these canids, which are the wild dogs. Yeah, so thank you so much. I think we understand that the wild dogs are endangered species, and we've got a very young population, which is less than 7,000, in the entire continent. I remember the biggest base of these uh, uh, carnivores is in Africa, okay? And now, how would you identify it, say this is a wild dog? For example, I've never been in the field, so usually you see these beautiful painted creatures that have got very big ears. So usually the ears are just way too big and the face is too small with a very short muzzle. Yeah, so some say these creatures have beards that look like uh, bat-like ears. Okay, and usually these animals are social. What do we mean? We mean that they rarely, or rather, they do not stay in isolation. Okay, unless otherwise, but they will be in groups. I think I've seen packs starting from 3, up to bigger numbers, and this literature says even up to 60. Okay, so usually they will live in groups, caring for one another. They have got a lifespan of 10 to 11 years. That is, um, uh, that is to do with, how they live in their environment, putting into consideration all the other factors that happen. So in most cases, these would weigh between 18 to 35 kgs. These are adults. So this is a very important point to note, because when you're going to immobilize, you need to estimate these weights, because sometimes, in the world, you may not have an opportunity to weigh these unless in captivity. Yeah, so basically that's what we need to know. Now, coming to the disease conditions that you may likely to encounter, we have got viral infections, bacterial infections, as well as protozoan diseases. So we have rabies, parvoviral enteritis, canine distemper. These being the most common viral infections that you may encounter when you are handling all dogs, and they are the ones that have caused a lot of mortalities when it comes to the dogs. Okay, so we have other things that you're going to meet, more especially in free-ranging animals, things to do with wounds that are due to probably snares and also probably human interference, in terms of poaching. We have got dermatological conditions. Mostly, you may encounter mange. Okay, yeah, we've got also in rare cases the trypanosomes, and also the tick-borne diseases such as babesia and ehrlichia. Leptospirosis is also one of the common conditions that you may likely to encounter. Okay, so coming onto rabies, usually we not say rabies is a viral infection, as I've said on, and I'm pretty sure we are all aware of why it's called a divergence and the like. However, rabies is the same rabies, the same way it presents in most of these uh, pets that we keep at home, specifically the domesticated dog. Usually it too present almost a similar way in in um in wild dogs. However, we are saying it has its common 2 forms of presentation, which is the excitative form or the aggressive form. Okay, where in this form you find that these dogs become less stressed. Okay, they are biting, anything that they come across. Okay, foaming, from the mouth, and also aimlessly wanders. Okay, so now by this form, when it gets to this form where they start, moving anyhow aimlessly, you find that these animals have lost their territorial boundaries, so they don't know where they should end from when they're wandering about. What happens is they are going to move and find themselves in communities. Sometimes they stop fearing people, you see, and you find them mostly in isolation. you have to be very, very, very careful when you see a wild dog alone, and you have to take proper precautions because it could be an indication of something strange, probably a disease condition, and most likely, rabies. And if you see any of them exhibiting such signs, then you have to start getting worried. So mostly these rabies, these dogs, we've said that they are always, social animals. So it's highly unlikely that you're going to find a wild dog around, unless there is something that is happening. In as much as they move long distances in terms of hunting, but you still find them in these parks. Okay, so we have also the paralytic form. Here you see these dogs becoming weak. Okay, they will be drawing. Usually they have got what we call the droppy jaw. So at the same time, you see them having swallowing difficulties. Now, when you look at this dog, usually it will try to move, but it keeps on falling, kind of arrangement, and they don't necessarily keep up with the rest. The other thing that you're going to see is they will try uh, to show like something is stuck on their throat, what we call bone on the throat. But initially, there is nothing that is stuck. It's just the paralytic form that is manifesting. So they will be trying to use their paws, trying to more or less like remove something, or else the jaws are droppy. And assuming you may think that no, maybe this dog has got it has something that is stuck, probably a bone on the throat, and you'd want to help, and that's when you get bitten. So we need to be very careful with that clinical sign. And the fun part with the wild dogs is that they have, they have, I think they react differently to water uh, when we compare them with domesticated dogs. Remember, there is hydro hydrophobia when it comes to domesticated dogs, but with the wild dogs, mostly they become hydrophilic. And you'll find that in most cases they get drowned in rivers kind of arrangement because of that affinity they have when it comes to water. Okay, so basically that is what happens with the wild dogs, I think. These are some of the common clinical signs you're going to see. So now, when it comes to management or other treatment of rabies, we understand that rabies is a viral infection and has got no cure. So at the end of the day, we have got no visible treatment. And in wildlife, more especially in free-range animals, we don't intervene when it comes to nature. Okay, so mostly we are not going to intervene with the animals. That means usually there is no form of intervention that is feasible. However, uh, there are situations where we have situations going beyond the point of safe return. What do I mean? When we reach a point of beyond the point of safe return, it means that these animals have gone into extinction, and we want to preserve the remaining population. Okay, and that's where intervention probably may come through. Yeah. However, we can always prevent these from happening by probably engaging the community members around these parks or other game reserves which are free ranging, by probably doing some vaccinations of the domesticated dogs, because we have these dogs that may spill over into these parks and probably cause the infection. You understand that it is highly unlikely that a wild dog is going to take the disease down into the communities, but the opposite is actually true, because most of the domesticated dogs, if they are not vaccinated, they can come across the disease and wander around and then mingle with these dogs and probably uh, inducing the virus. So in captivity, there's you can do some vaccinations. That is probably during the locations, the introductions, and the like, just to be sure of them. So you can always do those vaccinations in captivity and in zoos. However, in the wild, we don't intervene in terms of vaccinations unless the PSR is reached. So the next disease condition that is also highly um, um, uh, contagious is parvoviral enteritis. So usually this is going to affect more especially the pups, despite it having uh, some 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 effects on the adults. Usually it's much more common to the puppies. And you're saying it's still caused by canine parvovirus, type 2. These types can be type 2A, type 2B, type 2C. So mostly this is the type that is going to cause these infections. And what do you see? Usually there is a sudden onset of lethargy, where these animals are lethargic. They lose appetite, okay? They would always vomit, and after vomiting they will have also severe diarrhea. This now leads to rapid dehydration, and usually these animals are going to die because of dehydration, okay? And if at all they are in captivity, if you try to check on their temperature, you find that they have got fever, okay? uh, Blood analysis, usually leukopenia, is one of the things that you are going to see. This therefore tells us that this disease has got the capacity to cause even 100% mortality. Okay, so with this, we are saying, how do you then manage? As I've said, we rarely interfere with nature. Okay, however, in captivity, you can do supportive care, okay, of these wild dogs. However, this also depends on how easier you can access. Remember, this is an animal that is already down, and then we have got it being a puppy. Usually, they may not do well with anesthesia, and then you have to really be careful on how you are going to handle them. So in most cases, we do not interfere with animals that are in the wild that is free range. However, vaccinations are always encouraged when you are introducing these animals, back in the field. So the other thing you need to do is with the vaccinations, you can also vaccinate these that are in zoos and those that are in captivity, because remember, when you confine these animals, you increase the levels of stress, and the stress is one of the contributing factors, into lowering the immunity of an animal. Then we have got one of the most dangerous also, which is canine distemper. They call it heartburn disease. So this one, I think, um, there was an outbreak, I think, is it in 2000, that is in Tanzania, where these dogs that were introduced had suffered from canine distemper, and I think it wiped almost the whole population. I think they had over 52 and lost over somewhere around 49 of the dogs. So it's also one of the diseases that is very bad and very dangerous when it comes to the wild dogs. Okay, so usually what you see, you have got the nasal and ocular discharges. Sometimes if you look at the ocular discharge, usually it's kind of cheesy, like of kind of appearance, and then the the nasal discharge, you find that there's continuous drawing of mucus and the like, and because of this there is usually blockage in the airways, and you see these animals trying to sneeze and coughing, trying to cough out this blocking material. So this is what you're going to probably experience when you look at these dogs. And from there we have got um, the hardness of the nose and the foot pads, which is known as hyperkeratosis, where they form more or less like crust kind of arrangement. Yeah. And when it progresses now into the other form, then it goes into the neurological stage. Now, in the neurological stage, you see these animals starting to have seizures. Okay, they become ataxic. You see muscle twitching, more especially on the top of the head. You see the muscle being, twitching, and then you not say this is actually becoming beyond you. In most cases, when the paralytic form has been reached or the neurological form has been reached, there is literally nothing that you can do at this point. You understand. And in most cases, I think some people have recommended that once you see canine distemper, because of how hard it is to manage, you are better off not intervening, but to probably put down the affected individuals. Yeah. So when it comes to treatment options, there is no specific treatment. Okay. Only vaccination, captive or introduction programs. The other thing that you need to do is minimize contact with the domesticated dogs, because mostly these dogs are going to bring this infection. So if at all there is that overlap every now and then these dogs are not vaccinated, and remember you are having these dogs that has the potential to carry this disease, then definitely you have got a higher chance of um, having an outbreak and then lose quite a number of dogs. It's a devastating kind of disease. Yeah, so the other thing that I think almost each and every one of the wildlife vets is likely to encounter or possibly has encountered is things to do with snares. So these snares, you're saying they are mostly caused by human. Okay. In most cases, these snares, let me just say, these are just wires that are there to trap animals. So when they put these snares, in most cases, the target is usually the ungulates, or rather the herbivores, for probably, people poaching them for food and the like. But these dogs may find themselves entangled in these wires and causing severe damage to the tissue. So as you can see, there's a picture here of a snared wild dog. You can see from the light volume, yeah, there is a snare here, uh, which is causing, extensive damage to the animal. And this this thing, which is here, has got the potential even to cause, amputation of the limb. So at this point in time, you know for sure that this has to be controlled. However, what you need to do is mostly you have to immobilize these animals, and that would be the next stage we'll talk about, on how you immobilize, just to remove the snares. So be it in captivity, be it free range, you have to immobilize. And when you immobilize, ensure that you've got some supportive kind of therapy, that is do the wound dressing. Some wounds would require stitching, where you have to suture these wounds, mostly to just relieve a little bit of some pain, and also at least facilitate the healing process, depending on how the wound would be. Sometimes you may be required to possibly amputate and then allow the animal to move for the betterment of this animal. Sometimes these snares can be very bad, such that none of the salvaging processes will be good enough, aside from probably putting to rest the snared animal due to the extent of the damage. Yeah, I have to mention that usually these wild animals, they would heal, quite impressively, you know. They are not like most of these our local animals, like domesticated animals, but these usually they would, heal in most cases when you do some intervention with them. So you do the wound dressing, you always support this animal with some antibiotics just to combat, secondary bacterial infections. Okay, at the same time, you give anti-inflammatories. And when you give anti-inflammatories, remember you're just reducing the inflammation and facilitating the healing. So by so doing, you find that uh, these animals recover, unless it was very, very, very severe. Yeah, so basically this is what is involved when it comes to snares. sometimes you find that maybe this sneer had caused even, an abscess, and you have to drain this abscess, probably um, massages, lavage to probably some povidone iodine, and whatever care that is needed. Sometimes you are required to give some fluid. You can give IV fluid to these individuals, depending on how much level of dehydration you see from these animals. Yeah, so basically you have to do that when it comes to uh, when it comes to wound management, as well as the wire snares. You are going to most likely encounter these, and you need to be ready. You need to have the right tools, the wire cutters, and another tool that you may use to remove these dangerous and deadly wires. Yeah. So the other thing is that I feel we should talk about is the dermatological conditions. The most common one is mange. Most likely you may encounter this, mostly the one that is caused by sarcoptic mange. So usually what you see is you see these animals, trying to scratch around, like lapping around, trees, objects, falling, like trying to low whatever they are. And the other thing that you're going to see is you're going to see loss of hair, which is alopecia. You see loss of hair mostly in the elbow, the belly side, and also the face, equally the tail. So you see they have lost hair in these patches, and you start suspecting that this could be mange. However, there are a lot of causes that can lead into, hair loss, but mange is one of them. And you see these animals trying to scratch curettas. So most when they are scratching, for sure to say there's something that is irritating, because these the mites that cause mange usually burrow into the skin, okay, and cause that irritation. That's why you see these animals are scratching. This now progress into drastic, weight loss, as well as very poor body conditions. The more the irritation continues, usually it tends to distract these animals from concentrating into probably nourishing themselves. At the same time, it makes them become so less productive in terms of hunting. So they will lose their body condition, and at the end of the day, possibly die. It's much more common, more especially these animals that are social, the way I've said, these all dogs. They will keep on, transmitting this condition to one another, more especially during denning and the like. And the pups are an exception, because always they're the one that are a victim, because they are always, together in that den. It has led also to these animals losing or running away from their denning spot. Remember, you have to understand that these animals um, uh, um, who always utilize one den, and you don't have to try to disturb. So once there's a disturbance at the denning spot, uh, it means that these animals are going to move out. They are going to run. That's why even disease detections like these that affect the pups, it's hard for them to be noticed, more especially in the wild, because you don't want to go closer to the denning spot and observe these animals. You observe them from a very far distance, so that those animals don't move from that den. You know, the other thing that you're going to see is these animals are going to have thickened skins. They are going to be lethargic, as earlier mentioned. And when all these happen, it's causing a lot of stress to the animals, and later when you lose these animals. Yeah, so treatment on this one, usually ivermectin has proved to be the drug of choice. Of course, usually in the world, if you've got the chance, you can even do the treatment after 2 to 3 weeks. Okay. And in most cases, you can do this via betting, dating, and the like. Okay. You can always, if you immobilize, you can always give parental injections to these animals. In the zoos, or in captivity, usually it's easier to administer these drugs, because these animals under full control, unlike in the wild. So remember what I've said, we rarely intervene when it comes to disease conditions in the wild, unlike when these animals are in captivity. So in the wild, you allow nature to take its course unless you reach a point of, beyond the point of safe return, where the animals have gone into or are likely to go into extinction, and you have to salvage those that are remaining just to keep up with the crop. Yeah, so mostly this is what you have to do when it comes to these animals. Now, I think let's quickly look at the immobilization of these wild dogs. Yeah, I understand these are all topics that require quite some time, but we'll try to summarize as much as possible so that at least we can get one or two concepts regarding the immobilization of these wild dogs. So in most cases, you need to understand the reason or the purpose for immobilizing these animals. Sometimes it could be um, for reasons of research, okay, disease surveillance, okay, maybe putting off monitoring or satellite collars so that you can monitor these individual animals. It could be for reasons of translocation. So you want to move these animals to another area, okay. It could be also probably other reasons, maybe treatment reasons and the like. So you have to look at what purpose am I going to do this, because it will differ when you want to deal with an animal that is sick. Usually the drug combinations may differ regarding the situation, or rather the concentrations of the drugs in terms of the dosages could also differ. Okay, we look at also the availability of drugs, and we understand that the drugs that we are going to use must be highly concentrated such that they will be used in smaller volumes, because the diets you're going to use are quite small, and you will not manage to load a whole lot of a drug that will require maybe 5-6 cc in one diet. So usually these should be highly concentrated drugs, and they should be at least safe to use. Mostly we recommend that you use the reversible drugs so that you're able to reverse the effects of that drug once you administer it to the animal. This is safe because it usually, helps you be in control of these animals. Okay, so basically you need to do all those, and at the end of the day, when you put those considerations, usually it turns out to be a very good, if from event. You look at also the time that you are going to do through that immobilization. There are some times when you fail to do this immobilization because of the period of the year, or rather the season. So also you put into consideration how you're going to be accessing those things at the end of the day, you see. Now you also look at the age and sex of these individuals. Different sexes and age groups require different drug concentrations and the like. Usually for the males and those that have got uh, good body condition scores, usually the dosages tends to be slightly higher as compared to the females, and the like. Also for the females, only those that are pregnant are the ones that are going to have possibly higher doses, slightly higher doses, due to pregnancy. Okay, you also have to understand the behavior of these dogs. So mostly these dogs, let's look at these dogs. These dogs are always social animals, so they always try to protect their own. So even during the immobilization, you need to be considerate of the fact that they are always going to be around one another. And what happens is, if one of the dogs shows signs of weakness, these dogs may charge against that dog and probably kill it. They may not understand, say this is just a drug, okay, but they will try to attack this individual and possibly kill it. So you need to be there to protect this animal, more especially during immobilization. So when you dart this animal, you have to observe it from the time of induction up to the time the procedure is done. Okay, so meaning to say, what I advise to do is, these dogs sometimes they will become comfortable whenever if you are with them for some time, and usually they will lie around. So what you do is when you dart this individual, do not cause unnecessary noise. You just have to let the animal go and probably lie somewhere. By so doing, you avoid the suspicions from the pack members that there's something that is happening. And you observe up to the time when the drug has taken effect and the animal has been fully mobilized, and you approach. You always keep an eye on the other members of the pack, and possibly, pack strategically, where you divide the dogs from the immobilized animal and work around that animal until when you are done. Okay, so having understood the behavior of these dogs, usually you'll be able to decide whether to go ahead with the immobilization at any point in time. You will not immobilize these animals when they are in a thicket, like in trees. You are likely to lose this animal. Okay, so but basically it should be an area that is open where you're able to observe these animals. Okay, you also need to know the weight, determine the weight for your proper drug, you know, um, for your proper drug, preparations. Okay, so one thing that I have to mention is usually these animals or these dogs, they are easily approachable when you're in a car. So the darting is done mostly in a car, unless these animals are in captivity. That's when you can use other things like probably betting them, and then later on give or administer probably via a syringe and the like. Yeah, but in most cases in the world, you can approach these animals easily using a car. One thing you have to know is when these animals are hunting, it's higher and likely that you're going to dart because they are learning all over. So in most cases, you need to find them when probably they would have ingested, they would have, eaten something, or probably they are just resting, or they are moving, but not that much, like the hunting kind of movement. So you have got higher chances of mobilizing. But when they are hunting, you can notice, get hold of these dogs. Yes. So now let's look at some of the drug combinations that you can use. Of course, there are quite a number of drugs, and each and every day there's that involvement of other drugs, other protocols coming in. But we have got a combination of, drugs like Zolatil. So Zolatil can also be used alone. However, the problem with Zolatil is non-reversible. So if you're going to use it alone, you may spend a lot of time. You use higher dosage, and then the animal go down easily, but you will not be able to reverse its effects should something go wrong. Maybe there was a miscalculation in terms of, weight estimation, okay? And then you will not reverse this kind of, this kind of combination because this drug is non-reversible. However, it can be used alone, but on my side, I highly, I do not recommend. I always say you are better off working with things that you can possibly control should things go wrong. Yeah, usually when you just use Zoreto alone, these animals would take a lot of time to wake up. Sometimes even up probably maybe 2 hours or so. These animals would take a lot of time. Depending also on the dosages, because remember we are always estimating in the world, and no one will tell me that they are going to give the most accurate dosage unless it's in captivity. Yeah, it's quite a good drug. But the combinations of Zoletil and metomidine have worked really so well for me. I think that's one of the combinations I normally use. And usually this, you are able to, you reduce the amount of Zoletil you use, and because of the availability of metomidine. So metomidine can be reversed, and usually in about 45 minutes or so, you should be able to reverse, and then these dogs coming up very well. Okay, so this is what you may use. There is also a combination of Zoletil and Xyrazine. So also 0 to 1 xyrazine can be used, and you can always reverse xyrazine with your imbin, even at Pamezo as well. This usually also works well. Ketamine and medetomidine. Ketamine and medetomidine is also very good. You can usually use it. They can also probably use fentanyl and xyrazine. But this you have to reverse, this opioid fentanyl with the naltrexone and also reverse the xyrazine with possibly your imbin or any alpha-2 antagonist that you can use. Yeah, so basically, these are some of the drug combinations that you can use in these animals. Okay, so once you've made that concoction, the protocol that you want to use, later on now, the animal goes down. So what is next? Remember, what is next when the animal goes down? So if the animal goes down, uh, we need to care for this animal when it is down. So always protect this animal which is under immobilization from other dogs. Okay, always blindfold. When you blindfold these animals, you are reducing the amount of stimuli that is coming direct into these animals, and they tend to be very calm even during the recovery process. Also, you are protecting the eyes. Remember, the eyes sometimes may be dilated, and you don't want any foreign object to pierce through these animals. Okay, at the same time, you need to ensure that this animal is breathing by always opening the airway. What I recommend when you're in the field where you cannot intubate, most you can pull the tongue so that there is constant airflow throughout the animal. Observe the respiratory rate of these animals. Always check or rather monitor the vitals, which is temperature. Sometimes these animals may become hyperthermic, and you have to control the hyperthermia, sometimes using ice pads, also maybe just water, just trying to lower the temperature in the field. So in most cases, you need to do this so that these animals are okay. At the same time, you have to ensure that you work within time. You need to work within time. You don't have the whole day to be with this animal, but what you need to do is always try to be quick. Remember, you are using a drug that has got also some effects on the animal, but at the same time, you don't want to keep this dog down for some time because the pack members may move to go for a hunt. And the worst thing that would happen is leaving this animal in isolation. Because when it is in isolation, it becomes weak. When it is in isolation, it becomes vulnerable from other predators. So when it is in a pack, it is highly protected. So what you do is you have to do the procedure as quickly as possible. That's why proper preparations is always a key when you are dealing with these carnivores. Always prepare and always prepare for the worst case scenario. Okay? Do the best, expect the best, but prepare for the worst case scenario. So you need to have all your things set and always be attentive to anything that is changing with these animals. Okay? Work within time to avoid animals from waking up while it's in the process. If you are going to take too much time dealing with the dog, sometimes what I've seen, I've had incidences where after about 38 minutes, you start seeing the reflexes of this animal wanting to wake up. Okay, more especially when you use a combination of Zoretu and medetomidine. In most cases, these animals really will metabolize uh, these drugs very quickly. Okay, usually the duration will be somewhere around 40-45 minutes. They would have metabolized this condition, and I mean these drugs. So you need to work within time. You need to ensure that this time that you have is sufficient for you to finish your operation and be as quick as possible. Be quiet, do not make noise, always work politely, and do not lead to a situation where these other dogs, run away. Sometimes, if you see to say these dogs have started going, the pack members, you can easily call them, okay, so that at least they stick around, so that this animal, when he or she wakes up, will be able to meet with the other pack members. So always work within time, avoid, delaying. okay, depending on the procedure. What we're avoiding also is top-ups. I would not encourage, top-ups when you can do the procedure within time, because top-ups now will mean that this animal will go down for a for a long time. Okay, so now if it goes down for a long period of time, there is a higher chance of it not coping up with the pack. At the same time, top-ups sometimes lead to a non-smooth uh, kind of recovery. So usually the recovery is a little bit bad. They keep on falling, sampling up and down, just like that during that process. And you don't want to see that, because when that is detected by the group members, sometimes it's the reason why these dogs will attack their fellow individual and probably kill it. You see, because they take bites, and when they bite, usually it is a little bit more of it's much more traumatic, and like therefore very sharp teeth, okay, that would induce a lot of pain and probably cause internal damages and the like. So this animal will be compromised, and you don't want to have that. So always you need to work within your time and ensure that you understand the protocol you're using and the protection that you have to offer. Always look out to that. Yeah, so basically this is what you expect. And thank you so much for listening. I think I can get some questions possibly, and the other additions. I know we've got expertise inside here that are following. Thank you so much.
Thank you so much, Dr. King. This was really, really fascinating to see how you work with wild dogs. Yeah. So before I take questions from the students and from the online audience, I would like to ask a question myself. I'm just curious to see, like, what motivated you to join wildlife medicine? Why did you choose wildlife medicine?
Okay, thank you so much, Sarah. Sorry, I didn't muted. I muted my mic. Yeah, so wildlife medicine really. When I went to university, I think the idea was to do a large animal medicine. Yeah, and not wildlife. But I was motivated by, by my lecturers. To be specific, one of them was Professor Muso Munyeme. He's been a tool and an instrument who had, induced something in me, because one thing that he mentioned, say, a lot of people do not want to join the wildlife sector. Reasons being that it's challenging and there is higher risk. And I said, I think I'm a risk taker, and I want to that risk so that I can save, these wild animals in every way possible. So even when I did my first internship, it was organized by him, and really it was something that had been pushing me, because I look at these wild animals where there is little assistance and a lot of restrictions, but they still also need a vet. In one or the other, they still need a vet in all those things. And I wanted to be the change to that effect. So wildlife and wildlife conservation has been my biggest goal, and I wish I could do more when it comes to wildlife. So, and I encourage a lot of students, graduates that are out there, please try to venture into wildlife and just understand nature and be able to be the one that is going to be, a game changer in the wildlife sector. Thank you.
Thank you so much. That's really interesting. And one thing I also got I also got some of my passion from Munyeme, Professor Munyeme. I loved reading his papers, and that's how I got connected to him.
No, that's good. That's very good. That's very, he's
Yeah.
a very good man and determined man. I learn from him each and every day.
Yeah. Thank you so much. Now let's start with the students. Online audience, if you have a question, please raise your virtual hand, or you can turn on your video and raise your physical hand, then I'll come to you. Yeah, so let me just check in the class. Dr. Bridget, do we have any question from your students?
I was asking about the challenges which are mostly encountered when dealing with these these wild dogs?
Okay, thank you so much. King,
Okay.
do you want to get that one?
Yeah, I think let me try to get that one. So thank you so much, Roy, for that question. Usually we have got quite a number of challenges. Remember, these wild dogs really are hard to track, and in most cases, just getting closer to where these animals are is a challenge on its own. Okay. The other thing is sometimes you don't have a better chance of probably darting these animals. And in such situations, you find that you can be there the whole day trying to chase one pack. It goes this side, you lose it, and then you not say you need to do an activity. So usually they are not animals that are easily, accessed, more especially if at all these animals have not fed, they are hunting and the like. So it's a challenge on its own. Sometimes, as a vet, you have to endure long distances, not only on dogs, but also other carnivores. Okay, however, I work with lions, I work with cheetah, I work with wild dogs as well. So at the end of the day, you see that it's a bit, difficult. Sometimes also finding the drugs, the right drugs to use is also a bit of a challenge because of regulatory issues. Okay, so you need to be aware that every drug that you have is very, 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 very important. And the other thing you have to know is also the administration of drugs in these dogs. Sometimes they can be very skittish, and you don't want to miss a dart, because once you miss one dart, the whole pack flows away, and you don't want to lose them. So always you need to be good also with your gun. That is when you're dealing with these animals that are that are free ranging, okay, in national parks. So you have to be there, and it requires all your patience. So those are some of the challenges you're going to face, the long distances, sometimes the long drive combinations, let me say, maybe underestimations of, ages. Sometimes the animal was supposed to probably wake up, maybe let's say 45 minutes, you're supposed to reverse, and then it wakes up nicely. You find that maybe due to an alteration in the amount of drug that you've put, it takes a lot of time for it to work. You have hypothermia there, where there is constant increase in rise in the temperature. You try to pour water, do anything, the dog, can't just bring down the temperature. You understand? So it becomes a challenge because you don't want to lose that animal. And if you lose that animal, then it's something else again. No one is going to understand. Everything there is on you. So basically, you have that challenge when it comes to working with the dogs. They are susceptible to hypothermia, sometimes even bloat. Okay, so bloat is also one of the things, more especially if they are from feeding. Okay, and in most cases you get a better chance when these dogs are from feeding. So you have to monitor that. And in most cases, when you are faced with bloat kind of arrangement, always you have to intervene. You have to intervene by trying to to reduce the amount of pressure. Remember, what happens with bloat is like there's too much pressure in the abdomen that is compressing now on the diaphragm. And when it compresses on the diaphragm, now I've got restriction in terms of the diaphragm movement, meaning to say this animal at this point in time, he's compromised in terms of the respiratory aspect. So you don't want to lose that animal in such a manner. So I think those are some of the the complications that you may encounter. I hope I answered your question.
Yes. Thank you so much, Dr. King. We only have a minute to go, but I can see we have a hand from Dr. Koriwe, so we can quickly get that one, then finish up. Dr. Koriwe.
My quick question was which has always been having, although I joined the presentation a bit late, but let me congratulate King for taking this courageous and risky, challenge in his life as a veterinarian. Congratulations, King. I would like to encourage my students to also emulate that, like what he has done. It's a good thing to watch over the things which are very challenging and do them as a first comer on the scene. Now, I wanted to just ask a quick question about the carnivores. I mean, about these, especially the wild dogs. My biggest question in my life has been, how do you control the population? Is there any way? Because I know they give birth we have problems with dogs giving birth very frequently. And I know maybe their gestation period is very similar to our domestic dogs. So the bush population, is there any way of controlling with contraceptives? Can you dart them with contraceptives? Because there is a possibility of using progesterones to reduce the population. Otherwise, it will flare out so big. How do you do that? Can I hear from you, King? Thank you.
Thank you so much for that question. We rarely do that, more especially in the world, because we allow nature to take its course unless it's becoming a nuisance. So basically what I can say is we don't necessarily intervene. However, the only practice if at all need arises, it will probably maybe neutering, that's probably spaying these dogs. That is if it's gonna be practical. But at the end of the day, usually we don't necessarily intervene. Usually nature has got its own way of, trying to control the population. You know how these dogs do when the populations are high, sometimes they're going to split, and probably move to areas where they feel they're going to get a little more of some nourishment. Yeah, but I think in the audience, there could be some senior colleagues that may have a proper answer. Maybe if Professor Moso is there, I think he can probably elaborate more on the same. Thank you.
Thank you very much.
Thank you so much, Doc. I saw Thomas had his hand up. Thomas, would you go for it before we call up Professor Muso just to give his comment in 3 minutes?
Okay, I'm saying, what is the trend of the health of the wild dogs in recent years that have emerged?
I don't know. You're asking what the trend in terms of the health of dogs that has emerged. I think maybe from way back or what lady?
Yeah, exactly. Yeah, exactly that.
Yeah, so I think on that one, lady, I may not have the full or rather complete answer with regards to the same. However, it's something that I can look up for. But when you look at this in terms of the diseases and the population that are happening, usually I think it's almost the similar common disease conditions that I think have been recurring, more especially this virus. So not really something new that I can say. Of course, there have been probably some instances of leptospira, but maybe to a certain level. But I guess maybe someone might have a better answer, not to my knowledge.
Thank you so much, Thomas, for the question, and thanks, Dr. King, for the answer. We don't see Professor Munyeme in the room, so we'll move on. If he comes, then he'll make the comment in the chats. But I should take this moment to thank you, King, for your time. We know wildlife vets, they are very, very busy, but you made time to meet our students and talk to them. We really appreciate your time. Thank you.
You're welcome. Thank you so much once again for the opportunity. And if there are any other questions, please feel free to email me, and then I can probably, respond to them in due course. Thank you.
Thank you so much. We have some questions in the chat. If you still have some time, you can reply to them, or Maret can email you the questions and you reply, then we send them to them. So I will just share my screen again so that we should remind each other on the learning outcomes. All right, so from this session, I hope you are able to understand why wild carnivores like lions, cheetahs are captured. Secondly, you are able to explain effective capture and immobilization techniques for large carnivores. And thirdly, you are able to explain the drug protocols and how to monitor animals during anesthesia. Fourth, you are able to identify and manage and explain how to manage common diseases in wild and also captive carnivores. Lastly, you are able to explain the post-capture care and innovations in wildlife veterinary medicine. Thank you so much. Have a good day.